So let's talk about the epidemiology and the risk factors. Now, the data tells us that over 95% of hiatus hernia are all type 1. That's a sliding type, okay? But then you realize that the prevalence of hiatus hernia increases with age. And so you will see that patients over 80 years, the prevalence of hiatus hernia can reach up to 40 to 45%. Why? Because we have what we call the phrenoesophageal membrane. It becomes weak, and that phrenoesophageal membrane is what holds that junction we've been talking about in place. It becomes weak and it can degenerate, and that is what can set the stage for the hernia. Now, what are other risk factors for hiatus hernia? It could be obesity, it could be chronic coughing or straining. Okay, so yeah, something like that. If you have a patient who is coughing continuously, or prior upper GI surgery, prior gastrointestinal surgery, and as well as some congenital effects as well. So let's review the pathophysiology of hiatus hernia. In a healthy person, you realize that this membrane we just talked about, the phrenoesophageal membrane, along with the diaphragm and the lower esophageal sphincter, keeps the stomach anchored to the abdomen. So the stomach stays down, and then the diaphragm stays on top, and the chest stays up, right? But repetitive stress like swallowing, like vomiting, like straining, or even simply aging, this membrane will stretch and become weak. Now, once it can't hold the junction between the esophagus and the stomach in place, it slides up. And that is what we call sliding hernia, right? Now, when other parts of the stomach or organs join the party, then we develop what we call paraesophageal hernia. So usually it starts as a sliding hernia and then moves on to become a paraesophageal hernia. So let's ask ourselves, clinical presentation of the various types of hiatal hernia. Type 1, which is a sliding. The most common clinical presentation are symptoms of GERD, gastroesophageal reflux disease, GERD. Okay, now what are the symptoms? You can have heartburn, you can have regurgitation, you can have dysphagia, and sometimes you can have what we call the Cameron lesions.